I hope you can hear me. Hi, I am Hirmay Kulkarni. I am co-lead of JPF iBRETA, and I am thrilled to welcome you all for our inaugural training session series. Don't whisper, let's talk period. Throughout the series, we'll have 4 sessions on the topic of menstrual health, and it will start with our first session, which will be monthly hormonal circus. So before we begin, let me give you a brief introduction of JPF, that is Jnana Prabodhini Foundation. Jnana Prabodhini Foundation is a non-profit organization based in California, USA, and it was founded in 2019 with the mission of rural development, women empowerment, and education. So there are more than 100 plus active volunteers in Jnana Prabodhini Foundation. Moving on to iBRETA, that is Initiative for Bioscience Research, Education, Training, and Awareness. This our project is under the umbrella of Jnana Prabodhini Foundation, and we started a year ago with the aim to encourage and create platform for research and medical community to generate awareness about different aspects of health and diseases, and to develop scientific mindsets in students. So with this, we have divided our project into 4 different sub-projects. They are research, education, training, and awareness. In research, we are aiming to investigate an attitude among young biological researchers to address complex biological problems. In education, we want to develop a scientific mindset to address the biological questions in young students, hopefully to get young and brilliant researchers in the field in India. In awareness, our aim is to deliver a curated, authentic, and scientific information from the field experts to create awareness in aspect of health and diseases. And in training, we are aiming to provide expert guidance so that general public can manage and tackle important public health issues at individual, family, and community levels. So this session is our inaugural session for our training program, which we are starting with menstrual health. Previously, in our health katta sessions, which are our awareness part of our awareness sessions, we have had 4 different sessions, from how COVID is affecting the lifestyle to how liver is critical for your health. So for our today's first session, we have had opportunity. We are honored to have Dr. Girija Wagh as our speaker. She has experience in the field of OBGYN for almost 29 years, and her specialties and expertise are in IVF, infertility, PCOS, and neonatal care, etc. She holds membership of various committees, and she has multiple awards and recognition. So without further delay, I would like to ask Dr. Girija to commence our session.
Okay, thank you so much. Thanks a ton, Hirmay, for that wonderful introduction of the session. The purpose for which I want to congratulate the Jnana Prabodhini group for bringing up certain very important life-related issues on the fore, because this is something that is extremely essential. And especially, I am much awed by the fact that youngsters like you are at the forefront of bringing this to the community and to yourself. And that's something which is really, really laudable. So as I understand this particular session, which is going to be there for about 20 to 25 minutes, as you have told me, we are going to be speaking about the wonderful analogy that you have given to this particular session, and that is the monthly Circus. And that's a very nice name, I felt. And thank you for having me here on this particular evening. And I don't know, I'm just trying to close the chat box. Just a minute. Yeah. So here we are today discussing at this very, very wonderful gathering. And I can see that there are quite a few eager participants here, and I bring you some information into this very important monthly hormonal circus, as it's been named by the organizers so wonderfully. Yes. And friends, yes, life is a circus, and enjoy the show. And that is what we have to remember. And as you can see here, the clown saying, all I can do is to make others laugh, to keep myself from crying. Yes, and truly so is also something about menstruation, but it's not so very bad. And let's understand what this particular entity is. So naturally, this is a typical sort of a message coming from a young adolescent girl saying, why periods? Why can't Mother Nature just text me and be like, what's up, girl? You're not pregnant. Have a great week and see you next month. Just because someday down the lane, I'm going to become a mother. Why do I have to go through this ordeal till that time to have a cyclical menstrual cycle? Well, yeah, this cyclical entity is extremely important, and let's understand why. Now, if you look at menstruation, there are various names by which we call. I don't know what you all are calling it nowadays. But in our times, we used to call it as chumps typically, or maybe, we'll call it as Mahavari in Hindi, Masik Pari in Marathi, or periods, problem, chums, or auntie. Many times, I remember in the medical school, we used to call her auntie. But I don't think we should call her a problem, because many times patients say, I have a menstrual problem. No, it's not a problem. It's a very, very normal physiological function of your wonderful body. And therefore, you must not call it as a problem. And of course, since there's a lot of taboo and you want to keep it private and you want to keep it secret, it's so personal, many times you don't want to share it with anybody as to what's happening. And therefore, you'd want to give it some names rather than saying that I'm menstruating. So menstruation is actually a periodic discharge of the blood and the bloody tissues coming from the uterus. Now, we are going to understand what I'm meaning, that uterus is the womb, that particular area of your body where the babies form. And when the first time in the life when the girl gets her periods, that first period is called as a menarche. So many times if you come to a doctor for any consultation, we'll ask you, when did your menarche come? When did your menstruation start? And this is what we mean. At what age did you start menstruating? And what does this menstruation give us a signal about? It signals that she's growing up and her body is preparing to have a baby someday down the lane. So this is what about menstruation is concerned. Menstruation is that visible component where you're actually having this bloody discharge coming out of your body. While menstrual cycle is the entire cycle which starts with the first day of the first menstrual cycle and then continues till the first day of the next menstrual cycle. And that is a cycle. And we are going to understand that also. Now, we all understand that we have a lifespan, and especially since we are talking about menstruation, here I'm going to be speaking more about the lifespan of a woman. So the womanhood is divided into first component, that is 9 to 14 years of age, where they are usually called as girls. And then somewhere around 13 to 14 years of age, usually menstruation starts. And from there on, we call it as a reproductive age, that is from the age of 15 to the age of 49 in the American context, while in the Indian context, it will be from the age of 15 to the age of 45. Why? Because it has been found world over that women in India hit menopause a little earlier than their Caucasian counterparts, such as Americans and Indian women. So in our community, usually in the average menopausal age, menopause is that time when now hence on there is a menstrual cycle which occurred, which was the last cycle. And 6 months after that, the woman never got her periods. So this will happen usually after the age of 40 or 45. And that is the time when usually in a natural course of action, you will find that women will now not produce any hormones, they'll not have any periods, and that particular entity, when the woman after the age of 40 does not get a periods for a period of 6 months or more, that is called as menopause, the average age in India being about 46 to 47 years of age. So let's first understand the bodily structure of a woman. So if you look at the body structure down there, which is not even felt, even if you try to poke your hands and try to feel on the lower part of your body, you will not be able to find this structure because this is deep inside your pelvis, which can be checked only by a doctor who is trying to check you from the vaginal side, or it will be seen only when it gets enlarged, either because of a tumor or a pregnancy, or when we do a sonography, we'll be able to see that small little organ sitting behind your pubic bone. Pubic bone is the most, when you put your fingers down there on your body, even in a man or a woman, there's a bone right there at the end in the front, and that is called as the pubic bone. And this uterus is wonderfully protected and encased in a normal condition behind that bone. Now, what is this uterus consisting of? So basically, let's look at the size. If you look at the feast of yours, your feast size, your heart size is equivalent to your feast size. While if you cut your feast size into 3 parts, 1/3 of the part would be the size of your uterus. So that is how a normal uterine size would ideally be. And this uterus is, you are seeing here, is the cut section. It's a globular piriform. Piriform means a little triangular structure. And this has been cut section here for you all to understand. You can see that the wall of this particular womb, or what we call as uterus, is made up of a muscle naturally, because it has to grow one day. When the baby is forming inside it, it has to grow to accommodate that baby. And at the time of delivery, it has to squeeze to push the baby out. And therefore, a very special type of a smooth muscle is there present here, which is sensitive to hormones, because there are a lot of hormonal receptors even in this muscle. And therefore, this particular special organ and with its special muscle, which is called as myometrium, is the uterus. You can see here, it's written here. So this is the muscle of the womb, which is typically called as myometrium. While this particular womb is also lined by another very, very special structure. And that very special structure is the endometrium. Now, why is it so special? Because it's continuously undergoing a cyclical change throughout the cycle of the woman. And I'm going to tell you how. And this is the one which gets shed off every time that there is a menstrual cycle. So at the time of menstruation, this particular endometrium shades off. Now it gets a signal from the ovary, and this is the ovary. So you can see that by the side of your uterus, there are 2 structures which are like small almonds. And these almond-shaped structures are the ovaries. These ovaries have 2 important functions to perform. One is to release those hormones, which we are into the circus about, and 2, to release eggs. And then close by here, these are mobile structures actually. These are the fallopian tubes, which are in continuity from the uterine cavity. This is the cavity of the womb to the femoral end. Entire 10 centimeters length is what it is made up of. And it is the one which will encase the ovary. So this is how it will be. The ovary will be picked up by the fallopian tube, will be shrouded, not picked up, but shrouded by the fallopian tube when an ovulation occurs. And then this egg will come here, and which will transmit through the fallopian tubes into the fallopian cavity. Now, if that young woman has had an intimate relationship, when the semen or the sperms are deposited here in the vagina, that sperms will ascend with their own motility, get into the fallopian tube, fertilize the egg, and this fertilized egg will come into the uterine cavity, get implanted here, and start forming hormones. The moment this special hormone of pregnancy starts forming, it gives the signal to the ovary, oh, I am here. And then the ovary will give the instruction to the lining of the uterus, wait, there's a baby growing, no menstruation. So when there is no such signal, okay, there's no pregnancy, nothing has happened here, the egg which was released by the ovary got resorbed, finished its life, and then from where it got released, that luteum, that cyst also resolved, And then the endometrium came to know, oh, both the hormones have gone. There are, it's a balance between two hormones. We are going to see how. And these, when they both get released, then this endometrium will get released, which is called as menstruation. So while I'm talking to you, I would like you to put in the chat box, did you understand the anatomy of this particular uterus that I explained to you? So it gives me an understanding that you are understanding. If there is any problem anywhere, if you find it difficult, you have to just give me, tell me that we want a still more explanation, and I'll be giving you those explanations. So it's a good practice to be interactive. Thank you, Kiran, Shruti, Pranali, for helping me understand that you have understood Saili and Kshitish. Thanks a ton, yours. So now let's move ahead. So then I described to you already, and I'm again showing to you in this picture. So the shedding of this uterine lining through the vaginal opening is commonly called as a period or a menstruation. And this can be usually this menstruation is lasting for about 4 to 5 days typically, but sometimes it can be a little irregular, especially in the beginning of the menstrual life. So when Minaki starts in a young teenager, her system is yet not well developed. So for about a period of 2 to 3 years, sometimes they would have irregular cycles. But typically, when you look at the menstrual cycle, it will be typically 1, 2, 3, 4, 5 days. Variation is always between 3 to 6 days. And it will start off maybe with a little spotting. It would be heaviest in the middle, and then there'll be again spotting, and it will go off. So usually this bleeding would be about 4 to 6 tablespoons. And if we really measure, it's about 55 to 80 ml. So let's look at the menstrual cycles in adolescent girls. As I mentioned to you, the median age of menarche is 12 to 43 years. Naturally, these are population studies, and therefore we come to know. So by usually 12 to 14 years, girls should start their menarche. And if they don't start their menarche, they've waited for 15 years, then 15 years of age, they must seek advice with a doctor and try to find out why menstruation has yet not started. And sometimes girls will get a cycle before 10 years of age. And that's called as a precocious puberty or a precocious menarche, which requires investigations also, because sometimes there may be an underlying hormonal problem, some tumor or something, which requires to be investigated. But by and large, in a normal recourse, 12 to 14 years is the ideal time of starting menarche in the Indian girl. And the mean cycle interval would be 32.2 days in the first gynecological year. And menstrual cycle interval typically can be between 21 to 45 days, and each particular woman would have her particular cycle. Typically, every one of us has our own cyclicity, which you must be knowing. And that is what can vary between 21 to 45 days is taken as a normal range. Menstrual flow length should be 7 days or less. And the menstrual product use, when the patient comes to us saying, doc, I'm bleeding heavily or I'm bleeding less, then normally we have to ask the patient this question as to how many pads are you changing? What menstrual product are you using? Is it flushing? Is it clotting? Because usually menstrual blood, which is well in quantity, is a non-clotting blood. It is a clean blood which is coming out of. It's a non-clotting blood, use little dark in color. While if it is heavily bleeding, how do you know? Am I bleeding heavily? Then that means if you are having flooding, like you go to the washroom and blood floods out of you and it's large in quantity, or if you're having clots which are forming, which are coming out of you, or you're requiring to use a lot of pads, more than about 3 to 6 pads per day, all fully soaked, then, or maybe tampons if you're using them, then this will be called as heavy bleeding. So in a normal course, it will be between 3 to 6 pads per day. So let's look at a healthy menstrual cycle and the regular periods. A regular healthy period lasts between 3 to 5 days. I don't know, my PPT has a mind of its own. The flow can vary greatly and present pain and pelvic cramps. And there's nothing to worry about that pain and pelvic cramps. You just go for a walk, drink a lot of water, it goes off. And you need to track your menstrual cycle, quantify how many pads or tampons you use in a day. In teenagers, variations are normal, and in adult women tend to be more regular in their cycles. And you can see here that these are the usually menstruating days, 1 to 5 days. Then these are the days when the estrogen cycle is probably forming. And then you have this particular part of your cycle where there is a possibility of the woman, if she has an intimate relationship, getting pregnant. And then this particular blue zone is the area when, if at all the woman is pregnant, the pregnancy is trying to get implanted inside the wound. Now, menstrual irregularities like abnormal cycle length, heavy periods, severe pain, among others, are mainly caused by the hormonal imbalances. So what are these hormonal imbalances? Now, as we have understood right now, we have on the first day of menstruation, there'll be some bleeding. And then as we realize that later on, it's a bleeding-free time for a long time. And then this will be somewhere around the 14th day of the cycle, when you can see that the lining of the uterus is becoming thick, all ready for a pregnancy to happen. And then here, if the pregnancy doesn't happen, then there will be a withdrawal bleed of the hormones. The hormones will withdraw and the woman will start menstruating. So now what are these hormonal things? Now this you can see here is the cut section of the ovary. As I told you that this is the structure. This ovary contains various growth. You can see that there are various kind of eggs which are in the process of growing. And this picture here is trying to show you the release of the egg. So on the 14th day on a regularly menstruating cycle woman, 14 to 15th day, her ovary will release an egg, and this is called as ovulation. And the follicle from which this egg gets released or ovulated is the one which will continue to secrete hormones. So you can see here that the follicle here, you can see that estrogen and the progesterone are these hormones which are secreted by these cells around the eggs, the follicular cells. And these estradiol and progesterone hormones get into the blood stream. And these blood streams then goes into the brain. It reaches to the brain center. And you can see that this is one brain center which is called as the amygdala. And just behind the amygdala, there is the hypothalamus. And this hypothalamus neurosecretory section, just below that is a small little gland here, which is called as a pituitary gland. And this pituitary gland is the one which is secreting certain hormones, which are called as gonadotropin-releasing hormones, which will come from the hypothalamus, stimulate the pituitary, which come from the blood, because all these organs have those special receptors. And then it will release the LH, that is the luteinizing hormone, and the follicle stimulating hormone into the blood, which will reach the ovary. So this cyclical thing keeps on occurring, where there is a complete orchestration between the hormones released by the ovary, going to the hypothalamus, going from the pituitary, and continuous positive feedbacks, negative feedbacks keep on happening. And these are the ones which are absolutely wonderfully set in a cycle, like a wonderful symphony. And therefore, a woman will have a typical, absolute, perfect regular cycles. Unless and until there's some pathology comes in, some pregnancy comes in, or maybe sometimes nowadays women are so fond of getting stressed out, keeping awake in the night, all their hormones go haywire. And therefore, from here itself, their cyclicity will start changing. So you must have understood that the menstrual regulation of the cycle is 1, determined by the ovarian hormones, 2, determined and regulated by the pituitary hormones, and 3, determined and regulated by the hypothalamic hormones. So this particular thing is called, in our scientific jargon, we call it as an axis, and this is called as hypothalamo-pituitary ovarian axis. And this is the one which maintains the cyclicity or the orchestration of these hormones. So you can see here an enlarged picture of the same thing. Now this orchestration, as I mentioned to you, does not only depend on these things. Sometimes if there is too much of stress, or there is any tumor, any malignancy, any complication here, these hormones can go haywire. Additionally, there are other external hormones also which influence, like the adrenal gland. Over the kidney in our body, there's a small little gland sitting, which is very important because it gives off some fear and fright hormones. Whenever we get stressed out, whenever we are worried, if we have to run away, these hormones will come, like adrenal surge. And these also can affect the function of the ovary. So whenever you have too much stress, or if you are having your exams coming by, many times your ovaries may go haywire. Now, as you can see here, that the entire menstrual cycle is a hormonal circus which affects various things. So these are the hormones which are being mentioned here, the estrogen, progesterone, LH and FSH, how they are going in a various cyclicity. And these hormones determine the growth of the lining of the uterus, which is called as endometrium. So first at the menstruation, it will be shed off, then the menstrual will keep on growing, glands will grow, it will become nice hypertrophic, waiting for a pregnancy to occur, doesn't happen, it gets shed off. And these hormonal effects are coming from the ovary, which is releasing the estrogen and progesterone hormone, influenced by the hormones coming from the pituitary, influenced by the hormone coming from the hypothalamus. So I hope you are with me and you have understood this, that this is a wonderful cyclical change which is occurring entirely there. So if you have understood, please give me a thumbs up or tell me yes in the chat box so that I know that you are with me. So this is again the same depiction of the whole thing. Menstruation will occur, and then somewhere here there'll be ovulation. You can see how the ovarian cycle, the follicle is growing here, gets released, and this released follicle turns into a corpus luteum, which secretes progesterone. And therefore, you will have a premenstrual endometrium, which is so nice and thick and vascular with a lot of blood. And then there is all the hormones get withdrawn. There'll be menstruation, everything will buckle down, will get released. And then again, the new cycle will start after menstruation, where the endometrium will start growing. And this all will be governed by the various HPO axis related hormones. It's always a good practice to keep your hormone, your period calendar. Today, in our long time back, we used to put it on some calendar in the house, or we used to write it in our notebooks. But today, you also have an access to apps, and any of these apps you may consider. It's always better that if you have any menstrual disturbance, to put first it in a cyclical way, and then you can consult your doctor. And especially if you are a married woman or you are already initiated into intimate relationships, it's all the more important that you manage your menstrual cycle, keep a record of your menstrual cycle so that you can, in case you get into a problem, you can always consult your doctor. Now you can see here that this is a normal menstrual bleeding. And in a normal menstrual bleeding, apart from the hormonal things, there are certain chemicals inside the lining of the uterus, the endometrium, such as prostaglandin, endothelin, thromboxane, which cause tightening of the vessels, and other hormones which cause chemicals which cause vasodilatation. And these vasoconstricting, that is constricting the vessel and dilating the vessel hormones, are absolutely in balance. The hormones are in balance. So therefore, usually the menstrual bleeding is a self-limiting bleeding. What happens in a woman who is heavily bleeding? Today, we don't have the purview of discussing about abnormalities. We are only going to discuss abnormalities, but just a little sensitization here. These chemicals become imbalanced, and that is the reason why a woman will have a heavy menstrual bleeding. So you will see that if there is bleeding for more than 7 days, doubling up on menstrual products, needing to change pads or tampon each hour for more than 2 hours straight, needing to get up in the middle of the night to change pads or tampons, if there are blood clots that are size of quarter or large, or if there is irregular bleeding on your calendar, you need to consult a doctor because there is something abnormal. And while you are bleeding, you must remember that menstruation requires a lot of hygiene. We are going to discuss this much at length. You must take a proper balanced diet, have an active, and maintain general body hygiene, which is very important. So always ask this question, are my periods normal? And if they are not so, you can always find some solutions and find out why they are not normal. So if the cycles are very short, if they are very frequent, or if they are for a longer duration of time, you must consult a doctor. And usually the reasons underlying which have been caused are many times some substance use disorders like drinking, smoking, very high stress level, excessive physical activity, not only exercise, but some strenuous work if you're doing, low body fat, because today zero figure ka bahut jamana aur chaska hai. Very, very poor diet, polycystic ovarian syndrome, or any thyroid disorders can be responsible for functional issues, while other organic ones are also there, which we'll discuss later. So sometimes we are also worried about the sexuality related to these hormones. And it's so awkward when you have to talk to your mother, especially about birth control. And it's not my fault. I have hormones and think about sex. And she should be proud that I want to be careful and not end up in pregnancy. But friends, I must tell you that you must remember that in our country, we have certain laws and regulations. We do not encourage any kind of sexual intimate action before you are a major. Our law doesn't permit. So I'll give an example. Now, if you have a woman who has become pregnant, or is there any evidence suggestive of a sexual intimacy in a minor, we have a PCOS Act in our country where we have to report to the police that there is an evidence of sexual activity, because it may not be taken as a consensual sex, and that can be a lot of issues associated with it. And then I always wonder, because there are a lot of youngsters who come to me for consultation, and they tell me that, we are in a group and then we feel a lot of peer pressure, and we really do not know, doc, whether I should have sex or not have sex. And we are really at a question, when should we start having sex? See, we should know the law of the land where we are staying. In minors, we don't allow sex in our country, and the social structure of our country is such that usually sex is awarded into a married relationship. Outside the married relationship, it is not taken as a sex, but now adulthood is defined. And if you are getting into relationship, it should be a consensual relationship. There are no consents or whatever taken, but you must know what are the rules and regulations. And if you are going to get into an intimate relationships outside the marriage, also ensure that you are taking an advice, because you should not land up in an unwanted pregnancy, which can cause not only a social stigma, but it can cause you problems inside your womb, in your body, possibility of infection, complications, and most importantly, your heart. It's important. So these youngsters say, but I'm menstruating from the age of 13, and I have all the hormones in my body to make me pregnant. Or that implies that I have hormones to make me feel sexual, feel attracted, feel that sexual need inside my body. Then why can't I go and have sex? The answer which I give to them normally is that you are human beings who have a capacity of thinking, and you also therefore are more civilized than the other mammals. Like, for example, I have 2 Dalmatians who don't have that sensibility of thinking and understanding as a civilized human being would be. So this thought process has given us this understanding that we must have restraint, and we must understand our restraint and our limitations. And then why are you having such a long time? Like, you become adult, you get menstruation as a teenager, and then you become adult at the age of 19, because since you are an evolved being of this earth, you require a lot of time to mature mentally, physically, and emotionally to take on the responsibilities of your future life. So if you feel that I have a lot of sexual expression inside me, which I need to express, control it. You have to control it till you are mature enough to take the responsibility of the consequences. And if we go by our scriptures, be it in Quran, be it in Bible, be it in Bhagavad Gita, be it in our Vedas, it is mentioned that till the age of 25, usually, you have to practice what is called as brahmacharya. And why? Because you have to hone all those skill sets, that physical fitness, that mental ability, and that wisdom to be able to live a long and a healthy life, which will be fruitful and contributing to the human race, and not get into indulgences which may cause unnecessary consequences. Some of you may not agree to what I'm saying, but I believe in these thought processes, and I'm saying them after a lot of research, because that definitely can bring about a lot of stabilization and stability into the society. Because currently, because of this titillating stimuli which come from various corners in the environment, maybe your phones or the social media or wherever, you do get stimulated into finding that, is this right? Is this better? And that is where you have to understand where your wisdom comes from. So remember, and I really want to congratulate this particular organization, because the May 20th is the Menstrual Hygiene Day. And we have to remember that whenever we are talking of menstruation, we must understand that there has to be awareness about menstruation hygiene, because most of the women, the mothers, think that menstruation is dirty. There are no facilities in many places where women can use facilities or maybe discard their menstrual products properly. And 88% of menstruating women in our country use different kinds of materials. This can lead to reproductive tract infections, improper toilet situations all over. And many times it also causes a lot of challenge to the environment, such as women nearly throws away 125 to 150 kgs of non-biodegradable absorbents used during menstruation in a lifetime. And we must never forget as human beings that there is something called as a sustainable developmental goal, where all women and girls should be able to manage their menstruation hygienically, safely, in privacy, with dignity. And if you look at each one of these goals, from gender equality to no poverty to clean water sanitation to consumption production to life on land and below water, everywhere our menstrual cycle, menstrual hygiene all come into being. So it's been very sad that in our country, there is a very, very low awareness on menstruation. And 70% of menstruating mothers consider it dirty. 71% adolescent girls are unaware of their menstruation till their first period. And percentage of girls remaining unaware of menstrual hygiene practices in Indian states is phenomenal, especially in certain Bimaru states of our country. So if you look at 300 million Indian women and girls don't have access to menstrual hygiene products, 23% are school dropouts, 60% women change their menstrual cloth only once a day, giving rise to infection. 10% girls think menstruation is a serious illness, and 20% women don't use latrines during the menstruation due to cultural taboos. Old rags, husk, dry leaves, ash, sand, newspapers, any kind of materials are used because of ignorance. And then the pandemic also opened our eyes. Because remember, friends, be there pandemic, no pandemic, menstruation is going to continue, and provisions have to be made for women's health and hygiene. And therefore, I would like to conclude this talk by not only congratulating you all for being here today, but also to remember that yes, a woman's life definitely is a circus. You can see here a picture. So she decided to enjoy the ride, and that is what being a queen is all about. So bright girls are bold and confident. They're not ashamed or scared of the period for the body. Remember, it's a wonderful, normal function of your body, and be open about it, talk about it, seek help, and educate the rest of the community who is not as privileged as you are. I hope I have been able to reach to your expectation, Mrunmayee and team. And with this, I conclude my talk, and I'm open to questions if there are any.
Thank you, Dr. Girija. That was a wonderful introduction to the topic. I'm sure like all of us have like studied what menstrual cycle is at some point in their lives, but it's always good to refresh our memories before actually understanding what are the disorders, what the system is. So I think that was a very good introduction to the series. We have a lot of questions that we got from audience, but since we are going to talk about lifestyle and different disorders in like upcoming sessions, so I'll just ask like a few questions that we have got so far, which are related especially to the introductory part. And in the audience, if you have any questions once I ask like a couple of questions, please raise your hands and you can directly talk to Dr. Girija, and then she'll be happy to answer your questions. So, one of the things you talked about was like the talk is about how the hormones every month go up and down. And then one of the questions was, how are the mood swings during this? Because of course your body undergoes different changes, and so yeah.
Yeah, see, as you must have realized that throughout the menstrual cycle, there is a constant hormonal interplay that is happening. And these hormones like estrogen, progesterone are known to cause certain brain changes, of course. But what is very important is to you to understand that, okay, fine, these are related to my menstruation. So sometimes, usually, immediately pre-menstrual, some girls feel a lot of congestion, lot of heaviness in their body. Some of them even have a very severe disorder, and this is usually seen in the second and the third decade of life, which is called as premenstrual dysphoria disease. While they feel that they are absolutely, huge mood swings, they get upset about small things, they get depressed, they get angry, there's breast pain, there is generally bloating everywhere. Now, these are all issues which are, everything that happens, anything which is a behavioral abnormality starts with your thinking process. I always believe that as Dr. Swami, Swami Vivekananda has said sometime back, your thoughts are what make you. So if you are what, is because of your thinking. So sometimes if you go and analyze deeply into these mood swings, you'll realize usually there's some sort of a stress, there's some sort of an overwhelming, there's some sort of a pain, some fear somewhere, which gives rise to these mood swings. Now, in the today's era, there are a lot of tools which are available to a clinician to try to find out whether there is any such objectively analyzed through certain questionnaire to find out whether these mood swings are of some sort of a depression or a disturbance or a mental thought disturbance, which can be then guided to the patient in accordance. So we can take care of that. But then before that, I sometimes feel that intelligent women like you and me can always, write your diary, try to find out what my mood swings are, what is it about, how can I deal with, and many times we can find our own solutions. If that's not possible, you can speak to your friend, your colleague, or your, a close partner. And if that is also not possible, we are always there as doctors to guide you and help.
Right. So just like how we should keep track of how actual periods are going, we should also keep track of what's going on with our lives, just so that we know if those mood swings or in general mental pressure is because of any of the situations going around. Right. Thank you. And one more question was, although this talk is about how menstrual cycle goes, but you mentioned that the estrogen progesterone works. One of the questions was, there are also estrogen levels in males, and how does that affect their hormone? Does that also undergo hormonal cycles, and what are the effects of it?
Pardon, can you just repeat your question? I'm sorry.
Yeah, sure. What's the effect of changing estrogen levels in males? Although like this talk is more about menstrual cycle.
In men, you're asking in the males, estrogen
Yeah.
cycle.
Yeah.
Okay, in the men, estrogen, if there's too much of estrogen in their body, there can be gynecomastia, where there is increase in the size of their breast. And many times, some those gym products or protein powders or external steroids, which men currently take for bodybuilding and all, they can give rise to these kind of hyperestrogenism, which gives rise to such kind of change. There is some question in the chat box about use of menstrual cup. I think that is something we'll deal with in our next session.
Yes. And then now we can go ahead and see the questions in the chat box, if that's okay.
So somebody's asked me about the taboo around visiting religious places during menstruation. Now, I just want to talk about this somewhere. Thing is, there has been always an evolution in the religious thinking. While long time back, before a particular, sect of thinking came in, the community was more dependent on women because women were taken as epitomes of production. And they were supposed to be the pallbearers of the society. Sometime down the lane, it so happened that men took over. And then this menstrual tabooing and things happened. But then there was also a scientific purpose behind it, because during the menstrual cycle, when all your hormones have receded, you are a little vulnerable to infections. Your immunity is a little low one. Two, there is some pain and cramp which is there. And then you are a little low on your resources because of that. And therefore, actually, I feel the community is very, very evolved when they said that, okay, fine, menstruation is a time when you take rest. Don't do your daily chores. So then these daily chores included doing housework, cooking, and going to the temple. Now, it got exaggerated over a period of time, and it became taboo, saying, oh, menstruation is wrong because that is, not bad. It's bad. And the God will say no and all that. That's wrong. Because, menstruation is a sign of fertility, isn't it? That means this woman is capable of having babies and she is healthy and therefore she menstruates. If you go into one of our states in West Bengal, in that particular district, they have this particular state does a lot of goddess worship. And here, in fact, they keep a menstrual calendar and a cycle of one of those goddesses. And this goddess, like on the day after the Navratri, when the god is supposed to come and stay with her now, after the Navratri is done, that day if a menstruation comes, they put a big silk cloth, all painted with, liquid kumkum, to tell the goddess is menstruating now today, so you have to go back again. You understand? So I think there is a lot of education in that, because having sex during menstruation can cause infection. It can cause pain. So these are simple things that we should interpret correctly and not look at it as a taboo. And if you ask my personal opinion, I don't think it should be a taboo to go into temples if you're menstruating.
Right. As long as you are not in pain, it's perfectly fine to go around. Right? Yeah. What other questions? Yeah, so you talked about different hormones and they should be at particular levels. So there are some pills that you take to adjust your periods sometimes for if you need to go somewhere or something. Is it safe to take pills to adjust the dates? And in general, is it okay to take painkillers, or do they cause any problems in future?
See, now painkillers have been given a very wrong name as painkillers. If you are having any menstrual discomfort or any kind of a cramp or a spasm, which is a little more painful than you can bear or tolerate, then it's better to take a medicine. And these medicines are simple mefenamic acid and spasmolytics, which have no long-standing effects or side effects. And usually the treatment for this condition, which is called as painful menstruation, is called as dysmenorrhea. You can take this painkiller, what you call as, we call it as non-inflammatory drugs, non-steroidal anti-inflammatory drugs. So these medicines can be taken for 6 cycles, and that would take care of your dysmenoric pain. So there's no harm in taking any of these medicines, but you take them in the right dose and don't unnecessarily be discomforted. Take it after a full stomach. Additionally, I am very much against pill postponement or a period postponement pill, because I feel that you have a wonderful cycle which has been set by nature. Now we are, let's say, in 2023 today. So in the last 22 years, women are coming of age, are menstruating, reaching menopause. A wonderful HPO axis, which has been blessed to you, been blessed with it. Why disturb it with external hormones? If you want to go trekking or wherever you want, you use your menstrual hygiene product, carry it with you. And why unnecessarily change your cycle? Are you understanding? This would be my personal opinion. It's better not to use any hormones for any reason whatsoever.
Right.
And there is something else. Sexual arousal has a pattern with the cycle. Is it known if there is any effect on male arousal? Actually, no. And these are all very, very subjective thinkings that are there. And there is nothing like a pattern on that. Of course, there are various hormonal changes and various kinds of responses that are there.
Right. Okay. Do we have any more questions? Somebody has a question, can raise the hand and then can unmute themselves and ask.
Yeah, well, how and why do cycles sync is something called as pheromones. There are some pheromones which have been identified. And because of that, you will have a cyclical and sinking of the cycle. Okay. So there is a lot of neuropsychological sexual, associations with the menstrual cycle.
There's a question asking, does like overthinking during periods when you feel stressed, is it going to have any long-term effects on the health?
Overthinking will have long-term effects on anything. Now your menstrual cycles will go for a toss. Later on, you'll start becoming obese. Then you'll have diabetes, blood pressure, heart attack, cancer, everything will happen. Or you may become, if that doesn't happen before that, you'll become some, psychological nut requiring antidepressants. So overthinking, just because you've been blessed with the capacity of thinking, don't overthink, no? Okay. So it's nice that if you're understanding that you're overthinking, find a solution. You'll find the solution to that also.
I think just like you mentioned, just maintaining a diary or like talking to somebody actually about it is much better way rather than just thinking.
Okay,
random things.
stress, mental or physiological problems, Kshitij, are associated with release of certain catecholamines. I showed you the cycle of the hypothalamus. So, when I was studying in a medical school 30 years back, we never had these hypothalamic effects affecting menstrual cycle. But in the current era, we are seeing a lot of young girls and women coming to us with menstrual disturbances. And one of the reasons is they are worked up, they're stressed out, their work schedules are not on time, they're not able to take proper nutrition. And they are worried, they're constantly feared, scared. There's a lot of, reference to the Google and search and research which goes on, which has taken away their own balanced thinking. And the surge of catecholamines which keep on happening in your body are chemicals which affect the HPO axis that I described to you. So if many times there was a very, I'm not purposefully taking a name because it's a public forum, but there was a very well-known celebrity, not in our country, outside, who had a lot of problems in her marriage. And then she had so much of problem that she had a disease where she used to take food and then vomit. She used to take food and vomit. And then she used to have no periods for a long period of time because so much of stress went and affected her hypothalamic factor, giving rise to these problems. I hope you understood.
Yes.
And that was a good question you asked me because that is our current challenge in the practice.
Right. Yeah. We have one more question. How do energy levels change with menstrual cycle? Do we need extra calories before periods? And I would add up to that, like since you lose like so much blood and you're having pain during those 4 or 5 days, do you need extra calories after that?
No, actually, during your menstruation, the blood loss is not so much. 55 ml out of 5 liters of your blood is not a big deal. And you can just, if your heavy menstrual bleeding is there, then it may cause you energy loss and tiredness and fatigability. But if for a normal menstrual cycle, it's absolutely, your body has that system to recover. And according to me, energy depends on your physical activity, where you have to have strength building. Energy depends on good nutrition, which is rich in calories, proteins, and micronutrients. And energy depends on your attitude also. You have to have a positive attitude all the time. And that is something that all of us have to develop it. Because if you are going to lead this humanity in future for a greater evolution, you better be energetic all the time. Are you understanding? And that is what is the duty of all of us, who are, especially you all who are youngsters, and me as a senior doctor here or an older person in the community, to inspire you that yes, we have to be energetic all the time. Okay.
But then, do we need like then more calories? Like if it's a normal system that body builds, then does it consume like more energy
Not
during?
really.
No?
It's not so much of a calorie loss. It isn't.
Okay.
It is a compensatory mechanisms are well built. Now, if you're already anemic, or as Kshitij has put it, you're already diabetic, or you're having some diseases, and then if you are already in that, if you get a menstrual cycle, then you may feel less energetic, you may feel sick, tired, like you have a patient, you are talking of blood cancer, but let me tell you, there are certain patients who have blood coagulation problems. Very rare, 1% or 2% of the population has. And then when they lose blood, they lose it in large quantity and they feel very fatigued at the end of it.
Right.
There are certain such conditions.
Okay. So to answer Kshita's questions, yes, the certain conditions can affect regularity of the periods.
Yeah.
We can take one more question, if there is any, or otherwise. Yeah. Do antibiotics cause imbalance in the menstruation?
No, they don't.
Okay. Okay. Thank you, Dr. Girija, and we are excited for your next session as well.
Thank you.
Yeah. Rumai?
Can I leave the session?
Yeah, almost. So, thank you, Dr. Girija, for this wonderful and insightful session today. And this was our first session of the series. And the next one, which will be menstrual well-being, diet and hygiene, will be conducted on 28th May by, again, Dr. Girija Wagh. And the next two, menstrual disorders and the We Friends, where we'll talk about what are the different products. And it will be more of an interactive session on 3rd and 4th May, and it will be and the speaker will be Dr. Vaishali Biniwale. So please ensure that you'll also join for our next 3 sessions. And I would like to thank you all for joining us today, and Dr. Girija especially for this wonderful session. And we also we are thankful for Jnanaprabodhini Prashala, JPF, and JPF, as well as our wonderful team members who we together put this wonderful series, and as well as JPF project planning committees, JPF social media team, and JPF website team. So thank you all. We'll see you next week.
Thank you. Bye-bye.